Hello from Nigeria. My name is Toyin.
Hello from Liberia.
Hello, I'm Pauline Anyona from the Organization of Africa Youth Kenya and the Partnership for Maternal, Newborn and Child Health.
The Kenya government has committed 0.5 of its annual budget to support girls' education, provide water, and provide funding for small businesses.
Liberia is committed to the PMNCH COVID-19 call to action.
We commit to building a model that leaves no one behind.
I'm the youth advocate who asked the Minister of Health about the government's commitment in 2020. Now I'm here to ask Dr. Salma, the Director of Family Health Department of the Federal Ministry of Health, what the government is doing to tackle inequity in this time of COVID and how the government is supporting the health workforce during this time of COVID. This is what she has to say.
The health workforce we recognize is critical, though we recognize also the limitations that we have. The government prioritizes access to the vaccines to the healthcare providers, especially the frontline workers. And we all know that majority of health workers in Nigeria, over 70%, are women.
Government is supporting healthcare workers, especially during this period, by making sure that salaries are paid in time, sending out infection prevention measures that are made compulsory. Capacity building continues. People continue to have more training. Task shifting and task sharing among health workers is being properly managed.
I'm here to follow up on progress that has been made. So I'm going to go in and talk to Professor Margaret Kobia, the Cabinet Secretary in the Ministry of Public Service and Gender, to ask on what progress has been made on gender equality.
What the Kenyan government has done is to have an affirmative fund, which is giving women in small businesses to the tune of about $5 million every month. It's a journey that we are committed to take to promote gender equality and women empowerment, and the youth voice is very, very important.
So the government have taken a lot of steps. The task force around the country have increased, or we have stepped up our one-stop center activities, or the family health division also have set and stepped up the youth-friendly centers, or more of them, talking more around safety for young people, the mothers. I think the government, especially on agriculture, there have been many small business loans that have been directed towards the female farmers or fishery and things that will help women to be able to support their families.
Por ser enfermera, nos tocó estar allí en la primera línea, recibiendo los pacientes pues, con COVID. Yo viajo en transporte público, entonces pues ya la gente estaba con esto de que la persona que trabaja en el sector salud, en un hospital, pues como que lleva el COVID allí a su lado. Entonces te subes al bus, te sientas, la gente te mira, te miraban, nadie se quería sentar a tu lado. Inclusive algunas personas comentaban que nosotros veníamos con el virus en el uniforme, que los podíamos contagiar. Así que pues sí, fue difícil. Tiene más de un año de estar sin trabajo, así que pues me tocó y me ha tocado hacerme responsable de todos los gastos de la casa. Y ha sido bien difícil, porque llega un momento que tú sientes que no te alcanzan las cosas y emocionalmente te afecta porque te pones a pensar, y si no llego a la quincena, ¿cómo voy a hacer? Tengo que trabajar, y si mi niño se enferma, o sea, es difícil. Y a pesar de todo, pues mi familia no se ha quedado sin comer, no nos hemos quedado sin pagar las cosas, y yo le doy gracias a Dios por eso.
Prioriza en la red primaria de atención de salud el incremento, entre otros, el recurso humano. Hemos cumplido con nuestro compromiso de asegurar que dentro de los primeros 100 días del 2021, la vacunación de los trabajadores de la salud, las personas mayores y las mujeres embarazadas esté en curso como parte de la Declaración de Equidad de las Vacunas y símbolo de esperanza para superar esta pandemia y sus desigualdades.
My name is Rejoice Banda, and I had the chance to interact with the youth, both from the rural and urban areas, to understand the challenges that the youth are facing when it comes to accessing sexual and reproductive health services in this time of COVID-19. And this is what the youth had to say.
Dzina langa ndine Mavis Njebe, mapura amene akumana nawo pa COVID-19 ndikuleka kwa nzanga amene analeka sikulu fo yakutenga mimba. Nzoti pano pa nzangayo ali ndi mwana, ndipo mwanayo akusowa chisamaliro foti anatenga mimba nthawi ya COVID-19. Ndipo ndikunena pano kuti pamene anthu amene amandilipira ine abweza mwendo mbuyo chifukwa cha business yawo sikuyenda bwino chifukwa cha COVID-19.
I have heard that the Ministry of Health has made commitments towards prioritizing women, children, and adolescents in this time of COVID-19. Walk with me into the Minister's office to understand more about these commitments.
So our government is fully committed, and this is to meet the needs of the women, the children, and adolescents. We are talking of maternal health, we are talking of neonatal health, we're talking of family planning issues. These are the real issues which our youth, adolescents, they face on a daily basis. But also we cannot run away from mentioning issues of gender-based violence. Furthermore, we will ensure that we continue the recruitment process of getting more nurses, more midwives. We will also make sure that we ensure that sexual and reproductive health related policies, sexual and reproductive health rights as well. Because our adolescents, the young men and young ladies like yourself, they need to know that they have rights when it comes to sexual and reproductive health.